This is Indonesia's biggest mosque. It can accommodate more than 10,000 worshippers, and it's an icon for the nation's believers. But in times of the novel coronavirus, it's a threat to public health, which is why a drive is underway to disinfect this and thousands of other mosques under the watchful eye of the Indonesian president.
We have rolled up and removed all the carpets because they are a potential source of disease, and we are spraying disinfectant.
Singapore is going a step further, closing all mosques in the city-state for at least 5 days. Disinfection crews are becoming a common sight from Seoul to Tokyo to Manila. The Philippine capital is now facing a month-long lockdown after President Rodrigo Duterte issued an order to suspend all domestic travel to and from the city. It's left shoppers worried about food supplies.
They said there'd be a lockdown and we're scared we might not be able to buy food and we'll go hungry.
The Philippine government has sought to reassure citizens and cautioned against panic buying.
We would like to stress that the transport of goods to Metro Manila from the provinces and vice versa will remain subject to guidelines.
Don't panic and don't stockpile, but avoid travel and large gatherings. That's the message being peddled across Asia as the continent tries to slow the spread of the virus. Official numbers from the epicenter of the outbreak suggest it's possible. On Friday, China reported just 5 new cases of the coronavirus in Wuhan, the lowest daily tally in the city since January. These days, the virus is spreading faster in other countries in Asia and the world.
While authorities around the world take ever more drastic measures to try to slow the spread of the coronavirus, the number of cases is rising. A tally by Johns Hopkins University counts more than 156,000 cases worldwide and more than 5,800 deaths. At the same time, at least 73,900 people have recovered from the virus. And some good news here, particularly from South Korea, with 76 new coronavirus cases reported today. The country has seen a fall in numbers down to double digits for the first time in over 3 weeks. It's a sign that the tough quarantine measures there are working. Well, joining me now from Singapore is Dale Fisher. He's a professor of infectious diseases at the University of Singapore and the chair of the World Health Organization's Global Outbreak and Response Network. Thank you for joining us. A flurry, as we heard, of action across Europe in the past hours, lockdowns in France and in Spain, school closures here in Germany. Is Europe making the right moves, do you think, now to slow the spread?
I believe there's other things they could do. I think there's a lot of lessons to take out of the response in Asia that aren't being implemented elsewhere in the world. So I do think there is more that can be done.
I want to ask you about what the UK is doing. It's taking a different strategy from many other countries here in Europe. I mean, there's very few restrictions in place. It's not canceling mass gatherings. It's not shutting bars. The theaters are still open. Schools are still open. What do you make of the approach of the UK?
The most important part of this response is in keeping the number of cases as low as you can. The most important things are early case detection and isolation. These are the people that actually have the virus. And in China, in Korea, and also in Hong Kong and Singapore, positive patients are kept in isolation. They're kept in hospital. If the numbers are too great, there might be a hotel, there might be makeshift hospitals created, some sort of alternative accommodation. But we don't let that burden of virus back into the community. Patients are only discharged when they've recovered clinically and they've had 2 negative tests 24 hours apart. And invariably people are much better then, but they're still shedding virus. I would much rather see Europe and the UK and other parts of the world indeed concentrating on where we know the virus is rather than where it might be, such as in bars and gatherings. I still think it's important to have those social measures in place, you know, the distancing, the cough etiquette, the staying
But just to
home
jump
if
in
you're
here, I mean, it
sick.
really does seem like, at least in the UK, that those social distancing measures aren't really in place. I mean, people are out at the bars drinking, theaters are open. Is that the right move?
No, I agree with you completely. This is the time the society can make a response, because if they respond and they bring in hand rub to the restaurant, alcohol-based hand rub, if they bring in sort of smaller numbers to the restaurants, maybe they're only a fraction of the number they normally cater to, that they sort of introduce this social responsibility, if you like, then the alternative is, as you've seen in other countries, everything's just closed down. So, eventually the restaurants and bars will need to reopen, because this outbreak's got a long way to run yet. But if those measures aren't in place, then you'll see it just keep coming back. So this is a new way of doing things going forward.
Briefly, if you can, South Korea and China, as we heard, they're seeing this drop in the number of new cases. Does that offer us hope potentially here that this is manageable?
It most certainly does. But as I mentioned, the biggest difference is that positive cases are in isolation. They're not sent home, and they're not allowed back into the community and until they're genuinely clear. It's human nature to cut corners and things if you're in isolation, and unless that's really rigorously enforced, then I think you see case numbers continuing to increase. So I'd much rather see countries adopting the measures that we're seeing in Asia successful.
Dale Fisher, chair of the World Health Organization's Global Outbreak and Response Network, thank you very much.